So today we are looking at Chapter 5, which is confidentiality and the management of healthcare information. Obviously, confidentiality is very important, um, not only for our ethical consideration, but also for patient trust. So this is really an important topic to think about. So what is confidentiality? It is the state of keeping something private, and patients assume that their private medical details will be kept confidential. We do not want to break that assumption and have patients thinking that the things that they tell us that we will go and tell other people. Because if that happens, then they won't want to tell us things um, because they're afraid we're going to share them with other people. Why is confidentiality so important? And as we learned about in previous chapters, there are a variety of different theories or ideas about how we should determine what's right and wrong. So looking at three of these different theories, we can explain why confidentiality is so important. From the utilitarian perspective, and the utilitarians look at the greater good for the greatest good for the greatest number. So what is going to be the biggest benefit to society? And they see that if patients do not feel that they can share information with their healthcare providers, this leads to a lack of trust, and then practitioners would have a harder time doing their job. So this is not a good outcome, and we should always keep our patient information confidential so that we can do our jobs more effectively. Duty-oriented perspective is a way of thinking about what is basically right and wrong and always doing the right thing. And in this case, personal privacy is a right and should never be violated. So we should never break confidentiality with our patients because they have a right to privacy. And then the third reason, if we look at virtue ethics perspective, virtue ethics basically look at what does it mean to be a good person. And in this case, a good person respects the right to privacy of others. So here are three different explanations for why confidentiality is so important in healthcare. Is there any time when confidentiality can be broken? So there was a court case, and it's known as the Tarasoff case. In that case, a patient told his counselor that he was going to hurt his former girlfriend. And the counselor did not alert the former girlfriend, and the patient ended up killing her. So following that case, the courts have established that practitioners have to maintain patient confidentiality unless the health and safety of others is at risk. So if a patient tells a practitioner they're going to harm themselves or someone else, the practitioner must break confidentiality to protect the patient or the other person. So the answer is yes, there is a time when confidentiality can be broken, and that time is when someone's safety is at risk. This is called the harm principle, and it requires that the practitioner must report threats to others and also threats to a patient's self. So if a patient says that they're going to kill themselves, a practitioner has to report that to the authorities and make sure that that patient gets treatment. And if the patient threatens to hurt someone else, the practitioner has to report that to authorities and warn that other person. Also, the harm principle requires that healthcare providers report cases of child abuse, contagious diseases. So if someone has COVID, let's say, for example, and is walking around coughing on people, sexually transmitted infections, as well as wounds caused by guns or knives. All of those things must be reported to the authorities. So, what is this right to privacy that we've heard about? Well, it really is twofold. The first part is the right to privacy from the government. The U.S. Supreme Court has recognized a right to privacy, for example, in order to allow women to use birth control. The Supreme Court found that a decision to use birth control was a private decision, and that people have rights to private decision without the interference of the government. So the government is limited in how they can interfere in the private lives of citizens. And this is one part of right to privacy. The second part of right to privacy is that private groups and individuals are also required to respect the right to privacy. So it's not just the government that has to worry about this right. There are 4 ways that privacy might be violated. Misappropriation is using someone's name or picture without their consent. So if you are going to use someone's name or picture, whether it's for marketing, whether it's for information, you need to have their consent. Also, intrusion is another way that right to privacy is violated, and that is when you invite a third party, maybe like a vendor, someone who's selling something, a salesperson, into the operating room without a patient's consent. Let's say you have a salesperson for a particular operating tool. If you were to let them come into an operating room without asking the patient first, that would be intrusion. Public disclosure of private facts, so that is if we were to release someone's private information, and also presenting someone in a false light to the public. So let's say you were doing an article about Medicare fraud and you used a picture of just any doctor, it wasn't someone involved. That would be considered a violation of their privacy because you're implying that they are involved in this fraud. So it's very important not only for the government to respect privacy, but also for groups and individuals to respect privacy. So let's talk about health records. Right now, a person's health records can be accessed by a number of different groups. And particularly because these are digital medical records, so they are kept on a computer, it is much easier for lots of different people to access someone's medical records. Prior to the age where things were stored on the computer, doctors' offices or hospitals had paper files, and it was a lot harder to get access to a paper file because you actually had to be physically in the building where it was located. Now, electronic files are available online, and so not only can doctors and other allied health professionals easily access your medical record, but also insurance companies and third-party billing services can access your medical records. And because they are accessible online, this provides a level of risk because someone can hack into these records, and then they would be able to view your health records illegally. So the book points out that even though the government and many people pushed for electronic medical records to make it easier for patients to get care in different places, it also makes it easier for someone to access your information illegally. So we talked about the push for electronic medical records, and that was part of HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. It was passed in 1996 to encourage the use of electronic medical records and provide safeguards for confidentiality. So we tend to think of HIPAA as having to do with confidentiality, but it also has to do with encouraging people to use electronic medical records. So what are some HIPAA regulations? So HIPAA is a whole set of rules that we'll see who has to follow in order to protect privacy and confidentiality. So doctors, pharmacists, allied health professionals, nurses, hospitals, clinics, nursing homes, and many other healthcare providers have to follow HIPAA regulations, as do health insurance companies, as do Medicare and Medicaid. The information that is protected is your medical record, also known as your health record, conversations about your medical conditions, billing information, and most other health information about you. When can information be shared? It can be shared for treatment and care coordination. So your doctor can share information with the nurse can share information with the rad tech can share information with the medical lab tech. They can also share information for payment, so to billing companies and to insurance companies, and then also family and friends that have been identified by the patient. So if you choose, your parents or your significant other or your friends can have access to your medical records as long as you give permission first. Some other HIPAA regulations, unless you give your permission, information cannot be shared with your employer about your medical conditions. Information cannot be shared for marketing and advertising without your permission. And your private notes from any mental health counseling sessions cannot be shared without your permission. What are patient rights under HIPAA? They have the right to see and obtain a copy of their medical records, and you may be charged a copying fee for that. You have the right to have corrections, I should say corrections, added to medical records. You have the right to receive a notice on how your information is used and shared. You have a right to decide if you want to give permission to share health information for certain purposes, such as marketing. You have a right to a report on how and why information was shared, and you have a right to due process if rights are denied. So if someone shares your, let's say they share your information to marketing, and you start getting emails about weight loss drugs, and you never gave your permission to do that, you could file a lawsuit against whoever shared that information because you never gave your permission for that information to be shared. In order for anyone to access your medical records, they need to have a legitimate interest. And there are three kind of areas of legitimate interest. First, it's patient care. So that's all of your healthcare providers. Then supportive services like quality review, billing, and risk management. And then social services like insurance, licensing, research, education, media, law enforcement, civil and criminal review, and public health reporting. Um, and typically for those last group, if, like, let's say it was being shared for research or education purposes, or it was being accessed, in those cases, typically any identifying information would be taken out of your medical record. Um, and this goes to the research portion. Let's say researchers want to do a study about diabetes or high blood pressure or pregnancy, and you happen to fall into one of those categories. They might want to access your medical records in order to do a study, but before they could do that, they would have to provide this group called the Institutional Review Board, which is typically, hospitals and other big research entities have institutional review boards, and they would have to sign off on it to say that yes, you could access information in order to do this study. And they would make sure that the researchers would get as little personal information as possible. So they might get information about your blood sugar, but nothing else identifying in the case of diabetes. So hopefully this gives you, I think this is the last slide for this. Yes. Hopefully this gives you a little bit of an overview for chapter 5. Make sure you carefully read the chapter as well as the supplemental material, and then let me know if you have any questions. Thank you.